Comprehensive Behavioral Healthcare, or CBH Care, is a private 501c3 nonprofit agency that has been providing mental health services to the community since 1969. We offer mental and behavioral health care services that are responsive to consumer and community needs. Our healthcare professionals treat individuals, families, and the community with respect, regardless of their race, age, gender, sexual orientation, disability, or illness. Since the 1960s, the state of New Jersey has funded mental health services for the uninsured and the underinsured. New Jersey has historically awarded and renewed annual contracts to mental health agencies like CBH Care to provide specific services and programs. Contract funding has been paid on a monthly basis. This system has enabled CBH Care to provide mental health services to consumers by ensuring that staffing and facilities were available when they were needed. Effective July 1, 2017, the state of New Jersey's fiscal year 2018, the grant payments in advance funding model is being replaced by a fee-for-service, or FFS, funding model. Under this new model, CBH Care and all mental health agencies will be paid after services have been provided to the consumer. Since the state of New Jersey has always required mental health agencies to repay any unused grant funds versus retaining them as a surplus to be used in running their operations, mental health agencies do not currently have the operating surpluses that will enable them to provide services, pay staff, maintain facilities, etc. at current levels while waiting for fee-for-service reimbursement. More importantly, the proposed fee-for-service rates do not fully cover the cost of providing those services. As a result, the 4 mental health service agencies in Bergen County have projected that in the first year this new model is in place, they will collectively lose $6 million in providing outpatient services. CBH Care itself represents at least $1.2 million of that projected loss. Under the fee-for-service funding model, CBH Care will potentially be forced to cut back on services, eliminate critically needed programs if they lose money, possibly reduce staff, etc., etc. This will result in fewer consumers receiving critically needed mental health services. CBH Care estimates that 800 to 1,000 of our consumers will not be served under fee-for-service funding. At least 50% of those consumers currently received medication monitoring services. Mental health workers have not received cost of living raises in 8 years, and fee-for-service funding does not include salary increases for those who provide these critically needed services. This will make it harder to attract and retain committed mental health professionals. On an average, 1 in every 4 adults and 1 in every 10 children suffers from some form of mental illness, so everyone knows someone with mental illness. This change in funding and its extreme negative impact on the ability of those who need critical mental health services to receive those services will affect everyone in the community. Untreated mental illness will increasingly become a significant community problem. Mental illness is America's leading public health crisis. That crisis is going to become significantly worse in New Jersey if mental health agencies are forced to cut back on programs and services due to insufficient funding. Please, express your concerns to your state legislators and county mental health administrator about New Jersey's mental health crisis and how fee-for-service funding will worsen the crisis. Production of this video made possible by a grant from the Investors Bank Foundation.